We're absolutely delighted at the turnout this morning at the Mayo Mental Health event, what's been happening. We had 145 people registered for this event across many different sectors: maternity, TUSLA, primary care, children's disability, family support work, and the attendance and the enthusiasm and I suppose the engagement and just even the conversations over coffee afterwards of an interest in joining some of the groups, either the Regional Infant Mental Health Forum, the Mayo Infant Mental Health Forum or the network. So I'm encouraged that we will have more energy to keep this work going, bringing infant mental health into everybody's business and as bringing an infant mental health lens to all our child and family interactions.
We're delighted to be invited to this morning because we feel it's so important to get the best start for our parents. We would meet them very early in their pregnancy, and I suppose it's about their social, emotional and psychological development throughout that pregnancy and the support that we're available to give to them through the hospital. We work very closely with social work department and with our perinatal mental health infant midwife. So this morning has been fantastic. It's the first one I've been to because there's things like the parenting support packages that I wouldn't have known about beforehand. When now we know that that support is there, maybe for some more vulnerable families, and also sometimes we pick up on things that we may not have seen in the pregnancy, but we see before they go home, and that's really important.
Found out a little bit about how important it is those early relationships are between babies and their parents. We're a pilot site for Preparing for Life, which supports mummies and daddies from early pregnancy right through to 5 years of age. There's probably going to be a little bit of change in family support going forward because the new literature is kind of signposting those early relationships, attachments, connections is kind of the way forward. So referrals come in, we decipher which is the best fit from our suite of programs, and we kind of match a worker to a family, and the family, I suppose, are kind of avail of the toolbox of supports that that worker has.
One of the key messages from today, I think, is that infant mental health is everyone's business, and that we all have a role in it. But I myself work in public health nursing, I suppose, and public health nurses are a core part of promoting infant mental health. I think this is highlighting it again, the importance of it and those relationships and those parent-baby relationships. I think today definitely highlighted all of the activities that are happening across all services. So I suppose from networking, it's very good then we say that we can network with each other and realise all of the services and the resources that are available for parents, supporting them to have those positive relationships with their babies and children, and therefore strengthen that infant mental health bond, I suppose, as well.